Good morning, everyone. As Eloise said, I'm Emily Murphy with the College of Applied Human Sciences as well. And our next speaker this morning is going to be the Honorable Roger Hanshaw, who was the Speaker of the House for the state of West Virginia. So with no further ado, Roger and I go back a few years. We both worked for WVU Extension together and now have the opportunity to reconnect through the Physical Activity Symposium. So
thank you very much. Well, folks, good morning. I had the opportunity many years ago as a young student to follow then Senator Arlen Specter from Pennsylvania on a program in Washington, D.C. And Senator Specter at that time took off his watch. Today we'd take out a cell phone and dutifully placed it right there on the podium. He looked out at the audience and he said, "Ladies and gentlemen, that's to give you the false impression that I care how long I speak today." So in tribute to Senator Specter, there's my cell phone. Folks, thank you for the opportunity to be here on behalf of the legislature. Thanks to Professor Elliott, to Emily, for the team for organizing an event that brings focus and hopefully brings clarity today to something that's become extraordinarily important to us as a state. So I had the opportunity to become Speaker of our state's House of Delegates 6 years ago. And it's been the highlight of my professional career, but it's also been an opportunity to watch a really interesting change in trajectory of our state over the course of just those past 6 years. Because we are, for the first time in my lifetime, I'll soon be 45 years old. West Virginia's been my home the entirety of that time of my life. We are for the first time in a position to be engaged in meaningful, serious, sustained economic development at a truly national and international level. And when I became Speaker 6 years ago, economic development prospects would come to West Virginia and we would engage with them in a conversation that usually began with what kind of tax incentives, what kind of financial payments, what kind of infrastructure grants, what kind of hard dollar assets we could make available to them for choosing to come to West Virginia and locate their business. Now fast forward 6 years, and when we have those conversations now, we'll always get to those questions. The conversations will always involve those items at some point, but the conversation now leads off with workforce. The conversation now leads off with access to healthcare facilities. It now leads off with what can we as a state offer to a potential employer in terms of allowing them to develop, recruit, retain, and grow a healthy workforce here in West Virginia. And that's fantastic, because what it means is we've shifted now to a place where we can focus as a state on growing our most valuable asset, which is the human capital that we have here. And it's not at all surprising why that's the case. The U.S. Chamber of Commerce estimates that every year employee absenteeism and absenteeism related to chronic health care conditions costs American employers around $225 billion, or somewhere around $1,685 per employee. The CDC's estimate is that globally, chronic absenteeism related to chronic health care issues is $1 trillion problem. $1 trillion problem. So we have work to do. We have work to do, and from the perspective of our legislature, we are actively seeking and wide open to input on how we best as a state address the need that we know we have. Because we know it's real, and we know that if we're going to continue to grow and expand and diversify the state's economy, which is singularly important to many of us, certainly to me, we have to do that in collaboration with professionals who can help us meet the needs of those employers, with individuals who have expertise that can give us the suggestions on the state level policy initiatives that we can champion, fund, support, and grow, that let us present an attractive package and an attractive place to live, work, and raise a family for those employers that we're bringing to West Virginia. And we try to make the business case for them. We like to point out data which says that for every $1 invested in a health care program for employees, the employer's health care costs per employee go down approximately $7. We like to refer to the U.S. Chamber of Commerce's data, which shows that every dollar spent on improving employee health yields an employer approximately a 150 to 200% ROI on those invested dollars. We like to cite those data points when the employers come to town. But we know that, or we think, achieving success in this area involves attacking the problem from both ends, not just from incentivizing the kind of activity and behavior that we want to see on behalf of the employers, but also how do we incentivize employees to take personal responsibility for their own healthcare decisions? How do we as a state incentivize our friends, our neighbors, and our family to make better healthcare decisions? Dr. Marsh's data this morning, to me, ought to be compelling. Ought to be compelling. When we can add literal years to our lives by virtue of the decisions that we make, then we as a state ought to be better positioned to make the case to our friends, to our family, and to our neighbors that there are tangible benefits to be achieved by making these kind of decisions. I want to spend my time with you and end this morning with an invitation. And that invitation is that we are a citizen legislature. The 134 men and women who serve in our state Senate and House of Delegates do other things. For 60 days a year, we have the privilege and opportunity to be together in Charleston to enact policy on behalf of the state of West Virginia. But for the other 10 months of the year, we are at home. We are in the 55 counties of West Virginia, living and working and doing the things that each of us as West Virginians do. And as a consequence of that, we rely upon professionals. We rely upon experts to bring to us policy recommendations and policy suggestions for what would improve the state of West Virginia. Writ large. The question writ large, what would improve the state of West Virginia? And don't think for a second that your suggestions and that your recommendations as experts in the field aren't taken seriously. They absolutely are. And they're taken seriously now. They're not taken, I shouldn't say they aren't taken seriously, but they're taken most seriously now, because now is the time when the legislature develops the policy agenda that we will act into law and that we will implement when the next regular session convenes. So we convene every year on the second Wednesday of January. We meet for 60 days, and then we adjourn and go home. And it's that 10 months, it's that intervening 10 months during which we actually develop the policy proposals and flesh out the policy positions that we will enact into law come January. So I want to encourage you to do as our last panel suggested, and that is to reach out and make direct personal contact with your local representatives, because the power of 3 phone calls is real. The power of 3 phone calls can literally change a vote. The power of 3 phone calls can literally lead to better, more impactful healthcare decisions in the state of West Virginia, because those 3 phone calls can, from time to time, move a policy position here in the state of West Virginia. Our doors are open. Our doors are literally open. The door to the Capitol building in my office is literally open anytime that we are there. We welcome you to visit us. I welcome you to visit me, because we want to continue to be attractive to those employers that we're trying to recruit to West Virginia. We want to continue to offer an environment in which employers can recruit and grow and retain and develop a world-class 21st century workforce here. But we know that because the data tells us those things are only going to be true, and we're only going to be successful if we are able to offer them a healthy workforce. So I'm anxious for the discussion here this morning. I want to thank Emily. I want to thank Professor Elliott and the team for the opportunity to be here with you today. Thank you.
All right, so now we're going to have our panelists answer some questions around the topic that the Honorable Mr. Hanshaw was able to kind of prime us with before we start. So I'm going to start by introducing our panelists, and I'm very excited that each of you are able to join us. John Deskins is at your far right, my far left. He is an assistant dean at WVU for outreach and engagement, as well as the director for the Bureau of Business and Economic Research. And then next to John is Melanie Seiler, who's the executive director for Active Southern West Virginia. And then last but not least is Sharon Lansdale, who is advisor for Rural Health Initiative and also the CEO Emeritus for the West Virginia Center for Rural Health Development. So I'm going to start with you, John, the first question. And again, Mr. Hanshaw kind of alluded to this, but I want to know, how does physical activity directly relate to the state's economy?
Great question, and it relates way more closely than people realize. I've been studying the West Virginia economy pretty intensely for 11 years now, and I believe the biggest problem that we face in our state is the fact that we are dead last among the states in terms of labor force participation. The share of the adult population in our state that is either working or actively looking for work is dead last among the 50 states. And we've been in that position for a really long time. And there's no way that we can ever achieve the levels of economic prosperity that we hope for. Let's just say a per capita personal income that's on par with the national average. We can never achieve economic outcomes like that unless we can get more of our people into the workforce. Of course, we're an older state. That everybody knows that. But it's not, what was that? I'm sorry, I thought you made a comment. Of course, we're an older state, and the fact that we do have an older population is part of it, but it's not by any means the only issue that we face. Even if you look at prime working age labor force participation, we're still dead last among the states. So where I'm going with this is we have 3 or 4 big reasons driving this significant deficit in labor force participation. And one of the big 4 reasons is poor health outcomes. We have a lot of people in West Virginia who would like to work, who would like to be, in the workforce, earning a living, contributing to the community, living a, healthy and prosperous lifestyle, but they're just not able to because of, some health impediment. Look at all the statistics. Look at overall mortality. Look at diabetes. You guys know this better than I do, I'm sure. But overall mortality, diabetes, cancer, lack of exercise, smoking, all these health outcomes, West Virginia is somewhere between 45th and 50th among the states in terms of these poor health outcomes. So, poor health outcomes are not only, hurting people's lives directly in many, many, many ways in a very personal way, but they're also making West Virginia less attractive to potential businesses. This is consistent with what Speaker Hanshaw was just saying just a second ago in terms of, one of the biggest questions that potential employers have is, hey, tell me about the workforce. But this labor force participation deficit, these poor health outcomes driving that deficit, they're keeping employers away from West Virginia. I mean, employers want a lot of things. Also, as Speaker Hanshaw was talking about earlier, they want a good regulatory climate. They want good tax policy. They want, a site that suits their needs. But one thing that's for sure that employers have to have is, a workforce that's ready, able, willing to work, and healthy, drug-free, properly educated, properly trained, properly prepared for the workforce. So anyway, I'm sorry that was a long answer. That's probably 3 times as long as you wanted me to talk. But poor health outcomes is one of the biggest challenges we face in our state. I mean, I wish that our problem, I promise you I'm going to stop in 1 second. I wish that our problem was that we had really bad tax policy, right? Wouldn't it be awesome if the problem that we faced in West Virginia were bad tax policy? If that were the case, we could just go to Speaker Hanshaw. He could fix it. We can have that fixed by March of next year. But the real problems that we face, issues around poor health and other issues like poor education outcomes and drug abuse, those are the real problems that we face in West Virginia. And those problems are not easy to fix. They're long-term challenges, and we're going to have to keep focused on these issues for many years to come because of the nature of the problems. So.
Thank you. So, to turn that around a little bit and to talk about some successes that have happened around business and industry in West Virginia, I'm going to ask the next question to Melanie. So, where have you seen the largest success in the West Virginia physical activity strategies in relation to business and industry through your work, Melanie?
In Active Southern West Virginia, over the last 8 years, we've been implementing a workplace wellness program, and that's a model that follows the CDC Work at Health curriculum. And so that foundation in changing the culture at a workplace is rooted in providing health education, aligning the training across work sites so that they're all speaking the same language within that initiative, putting time within the workday to take that training on, to have those wellness committee meetings, to build your initiatives. In that time, you're going to look at the criteria for evaluation. We're going to set that evaluation at the same standard across those work sites. We're also going to build in recognition. As we build that recognition, we're recognizing the businesses across the entire state. People want to work where there's a wellness plan. So you're going to attract a healthier workforce when you can boast those wellness initiatives. So we see that working in our area of active Southern West Virginia in those collaborations. So it's wonderful today to sit here with Dana Wright and Lauren Weatherford from WVU Extension, who contribute to the health education at our businesses. We have the Office of Health Services Research, who helps us with evaluation of those work sites. The Beckley Outdoors Project with the Beckley Chamber of Commerce and the Remote Worker Initiative. So we're seeing that collaboration work, but really it takes putting an aligned initiative across the entire state so that we can evaluate at the same levels, we can speak the same language, and we can show that there's value in those wellness plans at that state level. And just to say, we've had businesses participating for the last 8 years. So in 2023, there are 26 work sites that accomplished the training with us, impacting over 5,000 employees. We're ready to expand that threefold. Brian Leary is here today from WVU, completing his Train the Trainer certification. I'll take on the Master Trainer certification in the fall. We have the capacity to expand this out so that we can elevate the health of the workforce in West Virginia.
Thank you. And then Sharon, what role, so taking this to a different level, what role does the community then play in improving the health of West Virginia's workforce?
First, let me tell you just a bit about the center. Our mission is twofold. One, to strengthen healthcare delivery, and the other, to improve health. Very different missions. On the health side, we recognized, probably about 2010, 2008, that we weren't doing what we need to do to improve the health of West Virginians. The health of West Virginia is not dependent, only 10 to 20% of your health is dependent on the health care that you get. And we have good access in West Virginia to health care. But to improve health, we need to work at the community level. Prior to the pandemic, and then during the pandemic, there were studies that came out that showed West Virginia was #1 affected and predicted to be affected by the pandemic. What conditions in our communities led us to that, which also lead to high chronic diseases, contribute to the SUD epidemic, and future pandemics? We needed to improve the health of West Virginians. The study we saw was American Health, I'll have to get it. Anyway, their study said in the past 10 years, West Virginia's been at the bottom 10 of the most unhealthy states in the nation. And what are we going to do that? And that requires us working community by community. I think Clay Marsh mentioned that health is local. All health is local, and we have to work at that level. But then the other part of it is we are not going to program and service our way out of this. There will never be enough resources to have enough programs and services. They're very funding dependent. Funding comes and goes depending on different priorities of funders. So we have to look, and someone mentioned early, at those policy systems and environmental changes that need to be in our communities. You know, policies, the good doctor from Aetna mentioned the immunization school health policy. That's an important policy in West Virginia. If we lose that policy, our rate of immunization of 2-year-olds is in the bottom of at the bottom of national statistics. At school age, we're one of the top. So we keep our kids protected with that, with a good policy change. We also spoke at our table about what was it? Yeah.
Joint use agreements?
Common use, yeah. No,
Shared use.
shared use, yeah, I wanted to say common use. Shared use agreements between our schools and other facilities that open access to playgrounds in our community that have a fence around them that's locked during the day and stuff like that. So there's those policy. Systems changes are so important. The way we make decisions. We're building new schools all throughout West Virginia. One factor in that decision making should be, if we locate here or there, is it a bikeable, walkable community where kids can walk to the school versus bike? When we're doing changes in our businesses, What changes can we consider to improve the health of our workforce as well? But it's not just the workforce in the four walls of a business, it's also their family members and their retirees, which also impact the health and health costs of those businesses as well. So we have to work out in our community. And then environmental changes. I want to talk about structural changes in our communities that make our communities bikeable and walkable. So often, because we sort of view it as they're transactions. We'll build a trail here, we'll build this activity here or here. It doesn't really transform a community. To really lift West Virginia off the bottom 10, we have to have community transformation. And with that, you have to have a plan. If you don't have a plan, you got different groups and communities working, all achieving great projects and doing great things, but not coming together to really transform that community. That community will never have enough resources to do it on a transaction, a project by project basis. It has to be part of a plan. And what we've done is not only will it improve health, but it also creates an environment in those communities where businesses want to locate. Businesses want to locate where their employees and their families can be active, where there's active arts community there, there's a good education system, transportation, which is not just bus transportation, but mobility, housing, adequate housing. We're one of the oldest states in the nation. We need to think about what kind of housing do our seniors need so that they can live a long, productive lifestyle. So with that, I'll sort of wrap up with that.
All right, before I ask my next round of questions, I just want to look to you, Speaker Hanshaw, and do you have any comments on what any of the other panelists have said or any additional input?
Amen. Amen to all of it. Look, my opening comments were sincere. When we bring an economic development prospect to West Virginia now, we always get to what Professor Deskin says. We'll always have a conversation about taxes. We'll always have a conversation about sites. We'll always have a conversation about regulatory structure. But that's no longer the opening conversation, and I'm happy that it's not, because it means we've fixed a lot of those problems. But it now means we have the opportunity, and I will say opportunity, to develop our human capital. So we need help with that. The legislature is not the font of all wisdom. We need it from the experts. We need it from the practitioners. We need it from you.
So one of the biggest challenges that we have in our state is overcoming some of the barriers that we face. And so Melanie, the next question is for you. Over the last 8 years of working with businesses to implement wellness programs and change within communities, what are the largest challenges that you see to participation?
So where we run into challenges with the programming is that upper management buy-in. So if they're not willing to make the small policy changes within the work site, we're going to have that challenge. If they're not going to allow that training to take place within the workday, then we're asking those employees to spend extra time to make the initiative happen that's important to them. We also see that in turnover, and you see that across all sectors, that turnover also drags down productivity. And then previous wellness attempts that were not rooted in policy systems and environmental changes. And so we hear that often, that, oh, we tried that before. Oh, we did a step challenge. Oh, we did this, and it just didn't take off. And they have a bad taste in their mouths from something they tried before, but it wasn't rooted in data-driven, evidence-based programming that we're utilizing now.
Thank you. All right, John, what are some ways that we can boost health and the economy simultaneously?
Well, I think there are some ways that we can really kill two birds with one stone. One example is with outdoor recreation. We've made strides in terms of developing our outdoor recreation or outdoor tourism economy in the last few years, but there's still a lot more that we could do. Just think about the potential that we have for outdoor recreation or adventure tourism opportunities with the natural amenities that we have in West Virginia, the beauty, the scenery, all that we know about so well. And the fact that we have this Washington, D.C. population so close, and they can just do a day drive here, spend their money in West Virginia, enjoy our outdoor recreation economy. There's so much that we could do to further build that economy, but they don't have the side bonus benefit of allowing more outdoor recreation, more active, more physically active opportunities for West Virginians. And that can help people kind of get some momentum in terms of being active and being physically fit. And furthermore, like Ms. Lansdale was saying too, I mean, when people are thinking about locating in West Virginia versus another state, again, they want a lot of things. They want good schools, they want good taxes, so on and so forth, but they want, quality of life amenities. And many quality of life amenities are things like walking trails. We were just talking at my table about, walking or hiking or biking trails just a minute ago. They want things like that make your life better, that make your life happier, but that also, allow you to enjoy the outdoor scenery of West Virginia and be physically active and not just sitting on the couch watching, fill in the blank boring show. But my point is, these things can go together. Physical activity and improving physical fitness and health can match well, in many cases, with economic development efforts and making our state more attractive to businesses and people.
May I chime
Yes,
in on that?
you certainly can.
One of the things that we are very receptive to, and when I say we, I mean the government, the legislature, is a community-based plan for how to develop capital assets. So what we don't do, rarely ever, is just issue grants to the community to go do good things. What we fund are well-developed, well-thought-out plans that illustrate buy-in from a diverse collection of people who are going to bring it to reality and make it happen. So when we think about things like outdoor recreation, if that's not being offered by a for-profit company, and usually it isn't, but if it's not being offered by a for-profit company, that means it has to be developed and maintained by a community of interested parties. So we have resources available to expand our inventory of those assets if an interested, willing community has come together to say this is our vision for outdoor recreation in pick any community of West Virginia.
And I'll add into that, we do have and have seen that gap filled by our counties and our county commissioners and our parks and rec. But in southern West Virginia, now that we've lost the coal severance tax, our counties are losing dollars, and those assets and resources are not being funded. So I really push for everyone to advocate for city and county parks as much as you possibly can. Those are connecting to doorsteps of these communities. We have a governor that's invested in state parks. Those are gorgeous now. Where are the city and county park investments?
Okay, last question, and then I'm going off the cuff. So I'm not a native West Virginian, but I've been here since 1993, so I consider myself native at this point. But one of the things that I see when working in communities is the disconnect between West Virginia residents that have been here for a very long time and are really rooted in traditions and culture of Appalachia versus like the fear of newcomers coming in. So how do we marry those to really make sure that our communities and our businesses are strong, but not the fear of the unknown at the same time by newcomers coming into our state?
I think it's through engagement. You really have to engage the community in developing a plan. This is not a plan, and I'll use the example, we'll probably release it here in about 2 weeks, is the Smithers and Montgomery plan. They had, that community's been affected by a downturn of coal, retail, loss of a university. They had a lot going against them. But they decided we're a community of possibilities, and we're not going to sit there and complain, we're going to do it. So they looked at their communities, the two communities of Smithers and Montgomery, and said, we're right on the gateway to this new national park. So what is going to be our theme? And their theme was seniors and senior travel. Some seniors don't like white water, they like flat water. So let's build outdoor recreation along the river for seniors to come there. And so they have a comprehensive plan that not only deals with the physical assets in the community, but also what were the workforce needs in that community, and how do we need to train, because we want to retain our youth. What are their housing needs as well? It's a comprehensive plan to grow those two communities for the future. And I have to say, during the process, that the people that have lived there forever and are still there, as well as the few newcomers that are coming in, by engaging them and allowing them to have a voice in the development of that plan, that's how you bridge that gap.
Thank you. I could not have said that more perfectly myself.